to get consistently good results, I think one of the most important things is appropriate patient selection. So it goes along with what I was saying previously. You know, the patient needs to be the right age, the right period in their hair loss, and have the right expectations. Obviously, they need to have good quality donor hair. They need to have enough hair to create a balanced look. That does not necessarily mean a full head of hair or a particular density hair. Just balanced, or whatever way you look at the patient in a three-dimensional way, it looks complete, it looks natural. Patients very often don't appreciate that right away because they look at themselves in the mirror, it's like a flat image, whereas I'm looking at them from all directions and I can advise them appropriately. What else goes into a good result? Really, everything we do contributes. You take each step individually, it doesn't seem to be that significant, but the combination is what is the secret. So making sure you know, they remove the donor from the right area, that the donor is good caliber, good quality, good density. The hairline is in an appropriate way, not too low, not too high. It looks right from the front. Look at them from profile to see how it combines with the hair on the side of the face. Then you have your graft dissection. The grafts are trim, they're neat, they're kept hydrated. I always like to leave the hair a little bit long, maybe about 1 centimeter or so. That helps me when I'm inserting the grafts. It helps see that all the hairs are flowing in the right direction. Sometimes that's hard to see when you clip the hairs too short. If the patient has existing hair, I pay attention to natural pattern, trying to duplicate what nature had in there already. And also pay attention to the right size incision to match the right size graft. I always make very few incisions at the beginning and test the graft to make sure it's a neat fit. If the slit is too big, the graft may move within the slit afterwards and it doesn't turn out the way you planted them. On the other hand, if the slit is too tight, then you can tell there's almost an angry looking graft in there. So all these factors, I mean, nowadays we're moving on, we're not just happy with hydrating the grafts, we're now looking at what kind of solution we hydrate the grafts in. We're looking at, you know, nutrients, and now the big thing is antioxidants. Or, you know, there's a research that we're involved with that has proven that oxidative toxins actually can contribute to hair loss. And therefore, if we can keep the grafts in an environment that is anti-oxidative, then that should be of help. So all these factors, when you combine everything, I really think that's what makes a good transplant. You know, as opposed to one particular secret to it. You know.